Hello and welcome to another Facebook Live broadcast with MedStar Health. My name is Sarah Ridenauer and I'm joined today by MedStar Health breast surgeons Dr. Jennifer Sun and Dr. Patricia Wehner and plastic and reconstructive surgeon Dr. Samer Jabbour. Sorry. For 3 decades, mammographies have helped reduce breast cancer by 40%. It is the only test shown to reduce breast cancer deaths. Today, we'll be talking about what to expect during a mammogram, the options available to patients, and the importance of early detection. We'll also discuss some of the latest advances in breast surgery and breast reconstruction surgery, what to expect during the procedure and recovery. So if you have any questions for our experts, please let us know in the comments below. Give us a like to let us know you're watching and share this broadcast with your friends. Before we get started, first of all, thank you all for being here today. We appreciate you guys taking time out of your day to join us and answer all of our questions. So let's start off. If we could all everyone go around and give a brief introduction of themselves and the work that they do here for MedStar. Dr. Jabbour, we'll start with you.
All right, so my basic training was done in different countries, different places. So I did some training in Lebanon, some training in France, and then I felt the need to do some more training for cancer reconstruction. That's why I went to Houston to MD Anderson Cancer Center, where I learned how to reconstruct the breast from the leader in the field. And then I did more training about that at Georgetown. And now I'm here at MedStar. I work in multiple hospitals, of them Southern Maryland and Montgomery Medical Center. And most of what we do here is breast reconstruction for breast cancer.
Great, thank you. Dr. Wehner?
So I'm Dr. Wehner. I've been with MedStar since 2013, so it is almost 10 years now. And I'm Associate Program Director for our fellowship program also. I took over site director at Southern Maryland Hospital a little over a year ago now. So I split time between Washington Hospital Center and Southern Maryland Hospital. I see any type of breast patient, whether it's benign all the way through malignant, and we're really proud to be able to offer them, especially now at Southern Maryland, now that Dr. Jabbour is with us, basically the most technically complex surgeries that we can. And so it's been really amazing since he's joined your team earlier this year.
Great, thank you. And Dr. Sun?
Hi everyone, my name is Jennifer Sun. I'm a breast surgical oncologist here at MedStar Montgomery, but I also see patients out of Chevy Chase and Georgetown, but mostly I operate here at MedStar Montgomery. Like Dr. Wehner, I do see a slew of cases from benign to malignancies, meaning breast cancers, and I work closely with Dr. Jabbour to give our patients the best surgical, oncologic, and cosmetic outcome that they desire and that we want to achieve. I've also changed all over, not quite all over the world, but I'm originally from New York, then went to Boston, Chicago, San Francisco, and now I'm here in the beautiful Maryland area.
Awesome. Well, thank you guys again for being here today. So my first question is, what is a mammogram and why are they so important?
A mammogram is essentially an X-ray of the breast. There are 2 types of mammograms. One is a screening mammogram, which most women get starting at the age of 40. And I say most women if they're average risk. It views the breast in 2 ways. One is this way and the other one is this way. And most of them are done 3D now, where we can see all areas of the breast. And it's an X-ray where we detect abnormalities. If there's anything that's detected, then we move on to a diagnostic mammogram with extra views of the breast and with magnifications of the area of the breast that we would like to view. And that's how we detect any abnormalities or anything that needs to be further worked up, like a biopsy, for example.
Okay. And then Dr. Wehner, what types are there and how do each of them work?
So types of mammograms?
Yeah.
What does that mean? So, historically, mammograms used to be kind of a very grainy kind of X-ray picture. And then we moved into the field of digital X-ray, so digital mammography. And so the original digital mammography was a 2D mammogram. And so 2D is kind of what Dr. Sun was just saying, where the breasts are kind of put in compression in 2 different views. And so it's craniocaudal So they're looking from top to bottom versus kind of medial lateral, so left to right. Then about, about 10 years ago, 3D mammography came out, and it's become much more popular over the past really 3 years because insurance has started to cover it for almost every patient now. So the difference between a 2D mammogram and a 3D mammogram is a 3D mammogram still does those same 2 compressions that Dr. Sun just mentioned, but it also kind of creates a flip book of the breast. So as you're in compression, the machine itself will rotate around, and the machine will take multiple pictures, and they're small little pictures that when you look at a 3D film now, you can kind of scroll through them. So before, when you would see kind of an area of white or an area of density, you just got one view of it. And now kind of you get a full 3D view because now you can scroll kind of back and forth when you see that area. So a 3D mammogram is really where we're moving towards all patients, and it's really kind of the gold standard of what we're recommending for most women now.
Great, thank you for explaining that. And so who should be getting a mammogram, what age, things like that, and how often?
So there are 2 types of patients in general, the average risk patient and then the high risk patient. High risk patients are those who have a strong family history of breast cancer or who have genetics that predispose them to breast cancer. If they have a high risk of having breast cancer, then we start sooner than the average risk patient. So if anyone has average risk, then we start in general at the age of 40 with screening mammograms and go annually. If they're high risk, then we start earlier than that. And that all depends on the family history and when the first age of their first family member had breast cancer. If that's the case, then we obtain mammograms and possibly MRIs with their mammograms alternating every 6 months.
Okay. And then is it possible that, the test could give false positives, or Dr. Wehner, could you talk about the accuracy of the test?
Yeah, so mammograms are kind of our gold standard for the way that we're going to screen a breast. And mammograms, particularly as we've gotten better, so between the original mammograms to the 2D digital mammography to now 3D digital mammography, the sensitivity, so the ability to find something and be certain about it, has definitely improved over the years. So the sensitivity of a 3D mammogram as compared to a 2D mammogram, we look at kind of how many additional cancers will you find when you're screening patients, because the most important thing is you don't want to miss something. And so we found that from going from previous 2D to 3D, for every 1,000 screens, you were picking up like an additional 100 cancers. So that's a big improvement in the ability to find cancers. So a 3D mammogram, when we talk about sensitivity, really now is between like 92 to 94% sensitive, which means for most patients, it's a really great test.
And does breast density impact the results of a test? And if so, how? How so?
Sure, I'll pass that one back to Dr. Sun. You're on mute, Dr. Sun.
Yeah. So breast density just tells us how much glandular tissue is in the breast. So in general, younger women have increased breast density compared to older women. If that's the case, then it makes it slightly more difficult to see the breast cancers on mammography. So sometimes we add an MRI to supplement that screening, and it's best to talk with your physician about what is the best screening modalities for you.
Okay, and then this is kind of an interesting question. If you have breast implants, can you get a mammogram? Yes.
You definitely can, but I want to go back really fast to what she was just talking about with breast density, because I do think it's an important thing for patients to know kind of what we're looking for when we talk about breast density, because many patients now get a letter that goes to their house that tells them that, hey, your breasts are on the more dense side. So there's 4 levels of density that we look at. And so the first one is mainly fatty. And then it's something called scattered fibroglandular elements, and then heterogeneously dense and extremely dense. And the difference has to be with how easy we can read your mammogram, so how black your mammogram looks, versus how hard it is to read your mammogram, so how white your mammogram looks. So fatty tissue looks very black on a mammogram, and really, really dense tissue looks really white on a mammogram. New cancers normally show up as new kind of white small lesions. So when you have a really dense breast tissue and your mammogram looks very white, that tiny little new white lesion might be a little bit harder to see or harder to visualize. And so it's just important to understand that when we talk about it, the reason just has to be that fatty breasts are easier to view. And so when you look at a mammogram, it's just an easier read to have. And so it's not necessarily bad, the various densities of breast. It's just kind of what you have and why it's important to know about it.
Okay. Thank you for explaining that. So what happens if someone receives a positive result, you know, if a lump or tumor is detected? What are the next steps that they would take after that?
A positive result meaning that they found something on mammogram. The first step is not to panic, because not everything that is seen on mammography means that it's cancer, okay? After receiving note or notice that there is something abnormal on your mammogram, the next step would be a biopsy. That is done either via ultrasound or via mammography, or even sometimes with MRI, where they stick a needle inside that area, take a couple of samples, and send it to pathology. They always leave a clip behind to make sure that that is the area that was biopsied radiographically. So once it's sent to pathology, it takes a few days for the pathology results to come back. If that's the case, then it tells us whether it's a benign lesion, meaning there's no cancer, or if there is cancer. And if it is cancer, then we all work together, medical oncologists, the surgical oncologists, radiation oncologists, plastic surgeons, to give you the best surgical and cosmetic outcome that we can give you.
Great. And real quick, going back to talking about mammographies and, you know, who should get them and, you know, stuff like that. We have a question from one of our viewers, Stephanie. She asks, do vaccines impact your mammography results? If so, how long should you wait before you get a mammogram after you've received a COVID or flu vaccine?
So the vaccine, it's not so much that it affects your mammogram. Vaccines, particularly the COVID vaccine, so we haven't seen this as much with flu vaccines and other vaccines in the past, but with the COVID vaccine, a lot of times we are seeing axillary lymph nodes that get bigger. So axillary lymph nodes are kind of the lymph nodes that live right here under your arm. And so when there are big lymph nodes from under your arm, we can be concerned that it's a kind of mark that there's a breast cancer or something going on. But those lymph nodes can get really big for many other reasons. So benign reasons, vaccines can make them get bigger because your body is reacting to the vaccine. So after the COVID shot came out, we were starting to see a very large number of women that were having these very enlarged kind of tender lymph nodes, and we were seeing a lot of them on imaging. And so that's really where the effect on mammography came into play, is because the lymph nodes were looking bigger, and it's not for any sinister reason. It's just simply because you got your COVID vaccine and your body's doing what it should do after you get a vaccine.
Right.
So it doesn't inhibit your ability to get a mammogram. You know, if you do get a vaccine, you can wait a couple weeks, but you don't have to wait a really extended period of time to go get your imaging. Okay.
Thank you. That's good to know. I had no idea about that. And thank you for your question, Stephanie. Getting back into our questions. So we talked about what the next steps you take after a lump or a tumor is detected. Can we talk a little about breast cancer surgery options?
Yes, in general, there are two kinds of breast cancer surgery options. One is called a lumpectomy, also known as a breast partial mastectomy. And that means removing the tumor and leaving the rest of the breast intact. And the other one is called a mastectomy, which means complete removal of the breast. For a lumpectomy, it all depends on the location of it, depends on the size of the breast, the size of the tumor, we always work with our plastic surgeons to give them the best cosmetic outcome. So sometimes we can do a lumpectomy and work with Dr. Jabbour, where he can do an oncoplastic reduction on the same side and on the other side to make them look symmetrical and to get a lift. The mastectomy option for breast cancer, there are different kinds of mastectomy options. So the one that we all probably are aware about is called a simple mastectomy, where patients decide to go flat, okay? Other patients are candidate for something called a skin sparing mastectomy, where you save the skin but cannot save the nipple. And again, that is done with reconstruction, including implants or autologous flaps, meaning from the belly or from the back. Again, that's going to be a discussion with the plastic surgeon. And finally, the third kind of mastectomy option is the nipple sparing mastectomy, where you can save the skin, the nipple, pretty much the entire skin envelope, and remove the breast and get reconstruction at the same time.
Okay. Thank you for going through those. I'm going to pause for a minute and say thank you to our viewers if you're just now joining us. We've been talking with breast surgeons, Dr. Sun and Dr. Wehner, about the importance of early detection through mammography and our options if a lump is detected. If you have any more questions for them, you can leave those in the comments below. But after a woman has undergone the removal of her breast or mastectomy, breast reconstruction surgery is an option for many women. Dr. Jabbour is a fellowship-trained plastic and reconstructive surgeon at MedStar Health and joins us today to talk about our options related to breast reconstructive surgery. So thank you again for joining our discussion. My first question for you is, who is a candidate for breast reconstruction surgery, and what factors should be considered before the procedure?
So basically, everyone should have the options of breast reconstruction. So I think once someone has been diagnosed with breast cancer, it's always good to come and see a plastic surgeon so we can give them options. Like Dr. Sun said before, we have different types of breast cancer surgery. So in the case someone has a bigger breast and compared to the size of their tumor, and what is remaining is enough for us to do a breast reduction, we can do a breast reduction on that side and do a breast reduction on the other one to make it look even. If someone has a bigger tumor compared to the size of their breast, then we have other options that we can use when the breast surgeon does a mastectomy to replace everything that has been removed. And sometimes we cannot do for cancer reasons, we cannot do the reconstruction right away, but it's good for them to come and see us before the surgery. So we give them the long-term options. So they'll be flat for a while, but then we have many options later on to reconstruct the breast from what was left behind. So I think everybody should be given the option to see plastic surgeon to at least discuss the reconstruction options, even if they don't want it or can't get it now. But I think everybody should talk about it.
Right. And so what does a breast reconstruction involve? Can you talk about the process of it a little bit?
Yeah, so so two big things are involved in breast reconstruction. So when part of the breast are being left behind, like I said, we can do a breast reduction or fill the defect itself, and the patient can keep her breast. And the bigger part of when the tumor is bigger and the whole breast has to be removed, then we have two big categories for reconstruction. One of them is to use implants. So if a lady is on the smaller side and she's okay with having an implant, then we can offer her an implant. And more we're doing direct to implant. So she wakes up from surgery with her final implant in place. So there's nothing to do after that. So reconstruction is done. Some patients don't want implants, and some patients, depending on their body shape, can benefit from what we call autologous reconstruction, which means taking tissue from another part of their body, like spare part. Let's say they have a big belly, they want to get a tummy tuck. So why not do this at the same time? Take this belly and reconstruct the breast with it instead of throwing it away like we do in a tummy tuck. We can, depending on how they look, if they have more fat on the back than the belly, or if they already had a tummy tuck in the past, we can use the back. If they want to get the thigh lift, we can use the thigh to reconstruct the breast. So there are many places in the body where we can spare some tissue and get the benefit of both, removing the extra tissue that we don't want and using it to reconstruct the breast so it feels and moves like a normal breast. So to simplify it, two big categories here: implant-based reconstruction mainly silicone nowadays, or using your own body tissue. And the lady, depending on how she looks and what she wants, we can pick the area together. And definitely, we'll put all the options on the table and we'll help her choose what is better for her. And depending on how far she's willing to go to have her breast look like normal again.
Great, thanks for going through that. How much is breast symmetry impacted before undergoing surgery?
So I always tell my patients that breasts are very similar, but they are rarely like twins. So they look more like sisters than twins. So, but when we do the reconstruction, we can always do something to the other breast, even if the lady doesn't have cancer in it, to make it look more symmetrical. So most of the times, they will end up being more symmetrical after the reconstruction compared to where they were before. So we reconstruct the breast, and then let's say we lifted that one and the lady wants to be more similar on both sides, we can always do something on the other side. And I have to say here that even after a while, if they decide to come back and do something for the other side, it's still covered by insurance most of the time, because once you get breast cancer on one side, everything we're doing is for her to feel better and to feel better in her body. So even the other breast is also covered by insurance if we're doing it to make it match the cancer side.
Oh, that's good to know. And I like what you said, they're sisters, not twins.
Yeah.
So what are risks or complications that could be associated with surgery like this?
So depending on the type of surgery the patient pick and we help him choose. So implants, because they're foreign body, we're always afraid of infections. That's the risk we think about the most. However, with autologous tissues, there is less risk of infection. And if infection happens, we can treat it with antibiotic. However, there are other risks like wound healing, because we do scars in other places of the body, like the tummy, like a tummy tuck, but nothing that someone should be concerned about, because we'll be here. If this happens, we're gonna take care of it. So it might delay the healing process for a week or two, but we'll get to the final result either way.
And my next question is something I think that a lot of people have top of mind when they're getting a surgery of any kind. What is the typical recovery time and, the recovery journey look like?
So let's say, depending on the surgery type we pick, we have different recovery times. If we go with a simple option like a breast implant or breast reduction, they'll be back on their feet in 1 week, and usually everybody goes back to work after 2 weeks. If we pick surgery a bit more complicated, where we transfer tissue from another area, I'd say 2 weeks is a reasonable time to start feeling like yourself again, and maybe 3 weeks to go back to work. So depending on the complexity of the surgery, it varies between 1 to 3 weeks.
Right. Thanks for explaining that. So my last question for you guys is how we like to end all of our broadcasts. What is the message you would like for our viewers to take away after watching this today? Dr. Sen, I'll start with you.
Yeah, so everyone, please obtain your mammograms. Talk to your doctor if you feel something. Don't be afraid to come into the doctor. It's definitely, we're trying to help you and make sure we detect things early as opposed to later on. And again, if you have any questions, don't hesitate to reach out to us. I believe the number will be on your chat.
Yes. Yep. Thank you. Dr. Wehner?
So the biggest thing is know your body, know yourself, know what's different for you. So be aware that if you think something feels different, looks different, bring attention to it, get your imaging, come in and see us. I mean, it really is just paying attention and not being afraid to kind of look at yourself and feel yourself and know what's normal or not.
Right. That's great. Thank you. And Dr. Jabbour?
So for plastic surgery, we usually see you once you're diagnosed with breast cancer. And even if my advice to you, even if you don't think you want breast reconstruction, it's always good to come and see us so we can show you photos of the different modalities, so you know all your options, and then you can still decide not to get the reconstruction. And that way you at least know that you're doing your best choice while knowing what else you can do. And one more thing I forgot to say earlier, even if you had cancer a long time ago and you're not satisfied with how your breasts look now, we can always do stuff to make it look better or to reconstruct it if it wasn't reconstructed back then. So even if it's not a recent cancer and you need something to be done to improve it and you feel better in your own body, please come and see us.
Great, thank you. Yeah, and like you said, it's always good idea to just consider it. And like you said, see your options. Well, I think those are all great points to end on. Thank you guys again for joining us, like I said, and thank you to our viewers for joining us as well. If you would like to schedule an appointment with Dr. Sun or Dr. Jabbour at MedStar Montgomery, you can call 301-260-3292. And to schedule an appointment with Dr. Wehner, you can call 301-877-5607. We also have numbers that you can call to schedule a mammogram. So we'll be posting those numbers I just said, as well as the mammogram numbers in the comments. Thank you guys again for joining us, and we'll see you next time.
Bye.
Thank you.